Okay, hi, I'm Haley. This is.
Hi, I'm Brenda.
And then if you guys
Erica.
want to come in.
Oh, I'm Carla. Emiliana.
And we're gonna ask you a few questions about what it's like to be a PA. So starting off, we need your name and what do you do? What is your job title?
So my name is Amanda Shumway, and I'm a physician assistant for a trauma surgery group.
Okay.
Why did you choose this career?
I knew starting in high school that I really liked medicine, but I wasn't quite sure that I wanted to spend all the time and dedication needed to become a medical doctor. So I did some research and essentially through process elimination decided that I didn't feel as if the nursing career was something I'd be interested in either. And then I learned about what a PA does and started shadowing and realized that PAs get to spend time treating and diagnosing and working with patients in a team environment. And I felt like I'd be satisfied in that career without having to dedicate like 8+ years for medical school.
Okay, awesome. That's awesome. That's kind of what I.
And did you ever change your major in college?
Yeah, I actually did 2 years of biology, just general biology, and then that got me through like chemistry, biochem, physics, and all of those I needed for prereqs to get into PA school. And then I looked at what my curriculum for the next 2 years would be, and it was all like plant-based, and I decided that that wasn't as relevant to what I wanted to do, so I switched to nutrition. So that's technically what my undergrad degree is in.
Awesome. All right.
Could you tell us a little bit about when you knew that this career was the right one for you?
I would say probably after shadowing multiple PAs and a couple different types of doctors. And it seemed, and I find this true working as a PA, that the PAs really were able to get their hands dirty. They're able to do many of the things that doctors could do, but yet they seemed a lot happier than physicians. They were home on time. They just had like the work-life balance that I was looking for. And so I'd say somewhere maybe like my junior year of college, I figured that, yes, for sure, I'm applying to PA schools.
Awesome.
And I wanted to ask, what are the 3 most important things for these jobs, like skills for this job?
Skills. Number 1 is communication. So I talk all day long, and you're working with patients, whether it's in an outpatient setting like primary care, what I do in trauma. You have to talk to someone who probably doesn't have any medical knowledge or not to your level. And I'd say the second skill would be being detail-oriented. There's a lot of things that someone could easily brush over, like, the errant lab result or some casual thing the patient mentions when describing their symptoms, when in the end it's those small details that actually matter. And then the third thing, I don't know if it's necessarily a skill, but I think just having compassion, because you're often meeting people who are anxious and having one of the worst times of their life, or their family member is, and the information that you're trying to give them won't be as well received if you seem burnt out and nonchalant.
Cool. What else?
What are the jobs?
Okay. What is your workload? So how often a week do you work? What are your hours? How busy are you?
So I'm really busy. And I think it comes with a specific specialty that I chose for myself. My schedule is not the same every week. I work 14 12-hour shifts a month. And so some weeks I maybe work 4 days, other weeks I might work 10 shifts in a row, and then I'll have a long stretch off. So it's totally random. with that, I do have at least 2 night shifts per month. And so on a typical day, I'm in the hospital for at least 12 hours. I think it's more like 12 and a half.
Okay.
How does that balance your life?
Yeah. Does that work okay? Like with your life, are you happy with it?
Yeah, for now I am. We have enough advance notice to I can schedule things, and I don't have to use any of my like paid time off to go on vacation. I can just say, hey, I need 7 days off, and then I might pay for it when I get back just by working a bunch of shifts in a row. But I've just adapted to it. I know other people who have children have asked for set schedules where they really only work 3 or 4 days a week, and that's great too. So that's probably what I'll transition to in the future.
Awesome.
I was gonna ask.
Oh yeah.
What benefits can be expected in this career?
Say that again. What kind of benefits?
Yes.
Like, what can you explain?
Like healthcare benefits, things you would receive from work, kind of like.
Yeah,
Yeah.
it's so. For the most part, if you're working for any type of an organization, a hospital or a healthcare system, you are going to get a retirement account, like 401k or a 403b. You're going to accrue paid time off and have sick leave. What other benefits do I have? Those are the big ones I'm thinking of. Can you
Okay.
think of specific ones?
No, those sound pretty accurate. I know that my dad receives like a lot of benefits. I think it just depends if it's like just for different companies that you work for, or if you're in the military versus the things. Those are good.
Yeah.
We also,
Military has awesome
Yes.
healthcare benefits.
Yes,
We
it
just have,
does.
like the standard,
yeah.
whatever. Yeah.
I guess this is like the last question.
Yeah.
What advice would you give undergrad like students?
Interested in becoming PAs or just in
Yeah.
general?
For PAs?
Yeah,
interested
going into public health or PAs or anything in the medical field.
I would recommend that you start either volunteering or even just shadowing and observing different types of healthcare professionals. Even if you want to go to PA school, it's it's always a team process, and you can learn so much. Even if you start observing people in different specialties, because once you get to PA school, you're for that first year you're so focused on learning all the information, and then the second year you're so focused on just getting through your rotations, your clinical site rotations, that before you know it, it's time to decide what jobs you want to apply for. And it's nice to have a little bit of an understanding coming in, but then just to keep an open mind, because as you start learning more about the medical fields, you might change your mind.
Awesome.
Plus,
Well,
it's a resume booster.
oh yeah, yeah,
Yeah,
yeah.
not only are you smart and dedicated in terms of like studying and whatnot, but they want to see that you've done your research.
Yeah, awesome. And I think the more experience you have too, you can like see if you want to veer off into different specialties, and you can see what you really like hands-on. So I think that's really important. But thank you so much for taking the time to FaceTime all of us. We're all trying to crouch in here. Yeah, we all are really interested. We're all in public health, so that's why we're interviewing you. And some of us want to be PAs. What do you guys want? I don't know. We're figuring it out, but it was really good to hear your input on it. And thank you so much for calling and taking the time out of your very busy work life. And thank you for responding. And we all really appreciate it. So thank you. Thank you so much.
Bye.
Bye.